Hey everybody, Dan here with Pain for You. Today I want to talk about anxiety and depression. And a lot of people ask if they're equivalents of TMS. Is that TMS? Is that TMS? Officially, no. So I'll get to that in a second. Let's take a nice deep breath. Breathe in the peace. Exhale the noise. Breathe in the love for yourself. Exhale the judgment, criticism. All right. So, anxiety and depression, people will often say, is that TMS also? Classically, Dr. Sarno defined TMS as tension myositis syndrome, then tension myoneural, because it involved the nerves, then the mind-body syndrome. And he was mostly referring to chronic pain or symptoms that related to or stemmed from an emotional phenomenon, stress, tension, emotions. And so I've heard people say anxiety is an equivalent. It's a symptom of TMS. Depression, it's an equivalent. And I just wanted to talk about it. I don't have all the answers here. I'm not an anxiety expert. I'm not a depression expert. I've lived around depression. My mom had it clinically for a lot of years, psychotherapy for a lot of years. Anxiety, I see that all the time in my coaching practice and just living life. In the year 2021, most people have anxiety. So you're not alone. So let's talk about each of these individually. Anxiety, in my impression, is concern over a future event. Fear has a purpose. I've said this before in past videos, but fear has a purpose. It's supposed to be there to alert us to life-threatening, dangerous, really imminent, right now dangers. Fear's a good thing. We're supposed to feel fear when, in fact, the elevator door is open, you go in and the elevator's not there and it's just a drop. You're supposed to be afraid and react instantly. Fear is really a good thing. Anxiety, on the other hand, is exerting caution over a future imaginary event that's not even happening right now. Now, in some cases, there's two aspects to anxiety. There's the physical sensation of it, and there's how does it kind of get created type of thing. And so we can work ourselves into anxiety just by our thinking. And not necessarily the fact we have negative thoughts, but the fact that we believe they're true, and we can get into that negative spin, the rumination, the catastrophic thinking, the worrying about the future, worrying about stuff that's not even happening right now. We can create that feeling of anxiety. And that fires up the stress response a lot of times. The adrenaline, the cortisol, fight or flight kicks in. Because our brain doesn't really know the difference between a real, true, and present danger right now and one that we are imagining vividly. So sometimes our thinking can create the anxious thoughts, which can create the feeling of anxiety, the fight or flight. And that's very prevalent, very common in the TMS mind-body space. Chronic symptoms, chronic pains, very common, right? Is it an equivalent? Possibly. I don't know that we have to define it. But anxiety also can be the sensation you feel in your body, that jittery, fluttering heart rate. You wake up and you're just kind of, holy crap, what's going on? And in that case, I know I've had people argue with me and say, Dan, but I didn't do that to myself. I just woke up that way. I woke up, my heart rate was racing. And so I will give that to you. There are times when we're not consciously thinking, oh no, what if this happens tomorrow? And then before we know it, boom, we're anxious and our heart rate is going up. It's not always something we consciously do. But sometimes it's a subconscious thing. Sometimes we wake up with it and we just kind of get jolted awake with that. Oh, oh no, here we go again. And in my impression, when we wake up with it like that, that is the presence of adrenaline and cortisol, the stress hormones in our bloodstream, and that is the sensation we feel when we have those stress hormones in our blood. And here's the catch. To a person who's got a hypervigilant brain, always on the lookout for danger, a hypersensitive nervous system, the perception that, oh my God, there's some adrenaline and cortisol in my bloodstream, and we sense that, immediately our hypervigilant brain goes, oh no, what's going on? When in fact, I've heard recently that one of the common things that occurs when we start waking up from sleeping is that the body starts to produce a little bit of stress hormones, adrenaline, to wake us up so that we don't stay asleep. And so it is very likely in some cases that we start to wake up, there's a little bit more adrenaline in there, but a hypersensitive nervous system and a hypervigilant brain can go, what's that? And overreact to normal levels of adrenaline, which are common for when we wake up. So the key here is with anxiety is not to overreact to it. Don't define it as a new big problem to solve, right? Indifference works wonders for anxiety. Look, evaluate. Am I truly in danger? No, I'm not. Great. I don't have to worry about this. I can think about, what do I want to do today? How can I have some fun? How can I be productive, purposeful, meaningful, connect with others, right? This is not necessarily a new problem to solve. Depression. My take on depression is this. Depression is deep sadness, and we all have periods of sadness, the death of a loved one, the death of a pet, the loss of a relationship. We all have deep sadness that we experience. But I think sadness turns into depression when we combine the deep sadness with a big dose of hopelessness. There's no hope for me. And so when you combine sadness with hopelessness, that's when the depression kind of really feels like it's smothering you. And so the cure for depression is to initially find hope. That wherever you happen to be, you don't have to stay there. And I know, it's really easy for me to say that here. And I know people are going to say, Dan, you don't understand my life. You don't understand the people I live with, the experiences I've had. There is no hope for me. And, for people who are deep like that, I will encourage you to seek out a mental health professional. Some guy on the internet talking about pain is not necessarily, the be-all, end-all solution for everything that you're experiencing. However, keep in mind, if your hopelessness is about your physical symptoms and you've done the analysis and said, well, I have TMS. I've been told it's fibromyalgia or this type of neuralgia or this type of whatever. But I've done the analysis, I've learned about it, and it's TMS. What I'm going to ask you to do is take a leap of accurate knowledge, not a leap of faith, a leap of accurate knowledge, and decide that TMS means hope. TMS means there's nothing wrong with your body, which means there is hope for you to teach your brain that you're okay, so it can kind of let go of these symptoms and have them fade away. So if your depression is mostly about your physical condition, I'm going to encourage you to find the hope in TMS, find the hope in this diagnosis, find the hope in this work, look at the success stories and say, if they did it, I can do it too. Go to Pain For You, the Pain For You channel on YouTube, search for TMS Success, and you'll find a bunch of them. So find the hope. And then when you find yourself being sad about your physical condition and your symptoms, you'll at least have the hope, and you'll be just kind of sad with where you are, but not completely smothered by depression. So in either case, whether it be anxiety, it's that feeling of dread and doom and gloom. If you're anxious about your physical condition and your future life with it, again, finding that hope in the TMS assessments and diagnosis and self-diagnosis, really powerful, because once you truly know and you take it from intellectual knowledge to wisdom that there's really nothing wrong with me, you can truly get to the point where your anxious thoughts kind of slow down. And you don't have to take those anxious thoughts seriously. You can literally say, I'm not going to believe that anxious thought because I know better now. And I've accepted the fact that TMS is what makes sense for me. And in most cases, it's the only thing that makes sense to really describe why we have these symptoms. So, the approach that I recommend is not about fixing anxiety. It's not about fixing depression. It's not about fixing back pain or headaches or fibromyalgia or anything. My entire approach is feeding the brain accurate information, because for most of us, we've been fed misinformation and fear for so much of our life, in some cases all of it, depending on our childhoods. So my approach is not fixing pain. Yeah, it's called Pain for You, and I get it. It's kind of the positioning. But the approach is geared towards teaching the brain that you're actually not broken. You don't have a general anxiety disorder. You don't have depression, clinical depression. You have sadness and you're feeling hopeless. And so if you're feeling hopeless about things, just know that things can change. There are countless, tens of millions, hundreds of millions of people who have had clinical depression who have come out the other side of that. There are some that don't get out, but that doesn't have to be you. So we can make changes, subtle changes in the way we think, feel, hold our body physically. This is a depressed body posture. This is one that is not. And so we can use our physiology to change our psychology. There's so much here that I could talk about. And I guess let me know below if you have some specific questions surrounding anxiety and or depression, if you'd like me to tackle it in a future video. But overall, anxiety is exerting caution over a future imaginary event. Fear is a real thing. If there's a bear in front of you on the trail in the woods, you're supposed to feel fear, and that's a wonderful thing, because that's going to kick you into fight or flight, adrenaline, cortisol, amplify everything, get your heart rate pumping so you can run faster than you've ever run before. Or if he comes at you, fight like mad, right? Give you superhuman strength. So fear is a good thing. Anxiety, not necessarily. And if we're anxious about a future of chronic pain, let's get real clear that, if it's TMS, you've done that assessment and you've recognized that it is, then you have hope. And therefore there's nothing to really be anxious about a poor future, because we know that there's a way out, and this is it. So again, my approach is geared towards teaching the brain and the nervous system that you're safe, so it can dial down the sensitivity, the vigilance, the always being on guard, looking out for danger. And that approach, guess what? Even if you're doing it for pain, you're going to find by default that your anxieties will start to simmer down, and that once you start to get the hope about your physical health and your future that way, your hopelessness drops off. Then you won't even be as sad, because you're realizing, wow, I see a brighter future for myself. So depression, especially if your depression has been surrounding your physical condition, that can get resolved as well. And so when you teach your brain that you're safe and to trust your body, because the body's miraculous and knows what to do and knows how to take care of itself, so much can resolve. And so I think, overall, just what I want to let you know is that you're not broken. You just thought you were. And once you teach your brain that you're not broken, with some specific ways of doing this that I cover deeply in my course and my group coaching, so many of the challenges that we're currently facing become past history, and life takes on a quality of ease and comfort and joy again. And so I would encourage you to keep an optimistic mindset. Know that there is hope. Look, if you're depressed about other things in your life, whether it be relationships, whether it be, work prospects, money, who knows? There's hope for that too. But if you're also dealing with physical symptoms, resolve that, because it's a lot easier to deal with life stress, work stress, professional stress, relationship stress, if in fact you're not also completely consumed by trying to figure out your physical symptoms and pains. So let's focus on that if you've got that going. Don't focus on fixing the anxiety or the depression or anything. Focus on teaching your brain and thereby your nervous system that you're safe, that you're okay, so that the whole system can settle down. And you may very well be pleasantly surprised that your anxiety and your depression starts to lift and everything starts to take on a brighter look and feel to it. So, if you need some more help, painforyou.com/join. Check out my group coaching, which also includes a course. And the concepts that I teach there are not designed to fix pain or solve symptoms, but they are designed to teach your brain that you're going to be okay. And when your brain gets that message, the whole system, which the brain is the master control center for, the whole system starts to return to balance and settle down. So keep it in mind. Love you guys and gals, and I will see you tomorrow.